Hi everybody, in this video we are going to discuss about the filariasis, pathogenicity and treatment. We are going to discuss about the pathogenicity and treatment for the disease called as filariasis. And we already discussed about this particular disease in the previous videos. And now we are all aware that this disease, filariasis, is caused by a pathogen in roundworm called as what? Warchineria bancrofti. Okay, it is caused by Warchineria bancrofti. Is the worm that is causing this particular disease. Okay, that is causing this particular disease. So we have to remember the pathogen that is causing this disease, filariasis. It is well known as what? Elephantiasis. This disease is well known as elephantiasis, which is caused by Warchineria bancrofti, the pathogen roundworm belonging to the phylum Nematoda. So we have to remember that point. Now, how we are going to now discuss about the pathogenicity. Okay, how it is affecting this particular disease. Okay, how this is affecting this particular disease. Now, in the very beginning, as we said that the Warchineria bancrofti is carried by a vector called as what? The female Culex mosquito. It is carried by female Culex mosquito. Okay, Culex mosquito. So when this mosquito carries this particular worm, Warchineria bancrofti, in its third stage. What is the infective stage of the Warchineria bancrofti? It is the third stage, microfilaria larvae. We have to remember third stage of microfilaria larvae Okay, microfilaria larva. Okay, microfilaria larva. We are calling this as what now? The infective stage. Okay, this as the infective stage. Please remember, this is the infective stage of the Warchineria bancrofti. Okay, infective stage of the Warchineria bancrofti, which is carried by what? Female Culex mosquito. Now, when the female Culex mosquito comes and bites a healthy person, the very first symptom is, in its light infection, it causes filarial fever. It is causing, the very first symptom is what? Filarial fever. Okay, this is, we are calling it as what? Light infection. It is a mild infection. It is not so severe. There will be that fever that is seen in that particular person. We are calling it as what? Filarial fever. We are saying, okay, filarial fever. But this filarial fever is characterized by headache, mental depression, and increase in body temperature. Light infection is called as filarial fever. But this filarial fever, how do you identify? How can we determine, or let us say, how can we decide that this is a filarial fever or it is related to the filariasis? This will be identified with this combination, like headache will be there, mental depression will be there, and there will be increase in body temperature. So, filarial fever is characterized by headache, mental depression, and increase in body temperature. So, please remember that filarial fever is characterized by headache, mental depression, and increase in body temperature. Why we have to remember this is, in many other diseases also, okay, we can see the headache and also increase in body temperature, and sometimes maybe because of some stress they may be in mental depression, leading to mental depression. But all that will not be a conclusion, or we cannot conclude with this as what? Filarial fever. Filarial fever is characterized by with these three together. Okay, with these three together appearing for one particular individual. So remember that headache will be there, mental depression, and increase in body temperature. Okay, so then we can characterize, we can say that he or she is suffering with what? Filarial fever, which can lead to what? Filariasis. Okay, filariasis. Now, when a person is infected with this disease, okay, here the very beginning we will be seeing that it is leading to the inflammation of the lymph vessels. Why we are calling it as lymph vessels? Kindly note that this filarial worm, Warchineria bancrofti, it will be infecting and residing in the host body in lymph vessels. Okay, in the lymph vessels. Okay, in the lymph nodes, lymph vessels, or lymphatic tissue, we can say, in the lymph vessels. Okay, or otherwise it is there present in the tissue called as what? Lymph. In a tissue called as lymph, it is present now. So once this Wachereria bancrofti, which is in third stage of microfilarial larva, it is there present in the lymph, it leads to what? Inflammation of the lymph vessels. Inflammation of the lymph vessels. So it is leading to the inflammation of the lymph vessels. So there is one term that we have to remember for inflammation of the lymph vessels. Here we have to remember it as lymphangitis. Okay, lymphangitis. Okay, lymphangitis is the term that we have to remember. Please remember lymphangitis. Okay, lymphangitis. We will just look into this. Okay, lymphangitis. So what it is called as? We are calling it as what? Lymphangitis. Okay, lymphangitis. Okay, please remember this word. What do you mean by the word lymphangitis? When there is inflammation of the lymph vessels, it is called as lymphangitis. Okay, lymphangitis we are calling it as. And at the same time, it also causes inflammation in lymph glands. It also causes inflammation in lymph glands. So inflammation in lymph glands is called as lymphadenitis. Okay, lymphadenitis. Okay, lymphadenitis it is called as. Okay, inflammation of lymph glands is called as lymphadenitis. So you have to remember these words without confusion. If it is inflammation of lymph vessels, lymphangitis. If it is the inflammation of lymph glands, lymphadenitis. But here we have to make note of one point, that is, in case of heavy infection, okay, that there will be accumulation of the dead worms blocking the lymphatic vessels. Okay, in the case of heavy infection, there will be dead worms that will be blocking these lymphatic vessels. So when a lymphatic vessel, let us say that this is a lymphatic vessel. This lymphatic vessel is blocked by the worms that are dead. Okay, dead worms. So there is no chance for the lymph, the connective tissue, the fluid, to pass to the other part of the lymph vessel. So in such cases, what happens in this region? That lymph vessel will start swelling. Okay, it starts swelling. So here that's what is the meaning. So we have to make note of this. In case of heavy infection, dead worms blocks the lymph vessels and lymph glands. So when there are many dead worms blocking the lymph vessels and lymph glands, there will be what? Immense swelling. It leads to what? Swelling. Okay, immense swelling will be there. There will be swelling of that particular region of the body. And we already said which regions it will affect more. It is affecting what? The legs and the genital organs. Okay, legs and the genital organs. Okay, mostly if it is in the men, it is both the scrotum and the legs which are more commonly affected. If it is in women, it may be affecting the legs mostly. But otherwise, the different parts may be swelling because of the immense accumulation of these dead worms in the lymphatic vessels or in the lymphatic glands. So here there is one word because of swelling. Okay, we will be using one word called as lymphoedema. Please remember that you have to remember it as lymphoedema. Okay, lymphoedema is the word that we have to remember. Okay, lymphoedema is the word that is used for what? Immense swelling. Okay, this is happening or this is seen when there is heavy infection due to the accumulation of what? Dead worms. So when there are accumulation of dead worms more in the lymphatic vessels, that lymphatic vessel is blocked. Okay, that lymphatic vessel is blocked and there is no path for the lymph to move to the other part of the lymphatic vessel due to the blocking of what? Due to the blockage created by what? Dead worms. So that place will be swelling and that we are calling as what? Immense swelling. Otherwise, technical term that we are using here is what? Lymphoedema. Okay, lymphoedema. So here we came across three words: lymphangitis, lymphadenitis, and lymphoedema. So we should not get confused with these three words. Okay, with these three words now. And very interesting thing is that in this tissue, what is the tissue that is infected by this Wachereria bancrofti? It is the lymph. We are saying lymph. So in the lymph, there will be also accumulation of fibroblasts. Please remember this, very interesting point. Okay, there will be accumulation of fibroblasts. Okay, fibroblasts are accumulated in the lymphatic tissue, forming fibrous tissue. Fibroblasts are helping in formation of what? Fibrous tissue, which should not happen actually. This should not happen. Please remember that. Okay, this should not happen. Fibroblasts are getting accumulated in the lymph tissue and creating fibrous tissue. So this is happening. Let us say this is happening in the lymph. Okay, it is in lymph, the tissue. Okay, lymph tissue. Okay, in lymph tissue there will be fibroblasts accumulated and helping in formation of what? Fibrous tissue. That is not the point, or that should not happen actually, but that is created, which is very dangerous. Okay, which is very dangerous. And in other cases when it is very severe, okay, when this disease is becoming very severe, it also leads to what? The cells, okay, in the skin cells we have what? Sweat glands. Okay, in the skin what do we have? We have the sweat glands. Okay, we have the sweat glands. So here the region which is infected by this Wartburgia bancrofti, if it is okay consisting of the sweat glands, those sweat glands will be completely disintegrated. Please remember, in the skin the sweat glands are disintegrated. Okay, disintegrated means they are destroyed, disappearing. Okay, completely they are destroyed or disappearing. Why they are disappearing? It's because of what? The disease called as what? Filariasis. So in the skin, in that region where there is lymph, okay, infected with the Wartburgia bancrofti, okay, Wartburgia bancrofti, in that region the sweat glands will disintegrate. Once the sweat glands will disintegrate, it leads to what? It will be causing dry skin. Okay, it will be causing dry skin. So here one of the interesting point of this function of the sweat glands is what? To keep our skin moist. To keep our skin moist. So here what is happening? When the sweat glands are being destroyed, then it leads to the dry skin. It leads to the dry skin. So here with all these okay signs and symptoms, now the lymphangitis, lymphadenitis or lymphoedema or formation of the fibrous tissue in the lymph tissue, disintegration of sweat glands in the skin, okay, causing dry skin, all these are now these main okay symptoms or the signs to say that that particular individual is suffering with what now? Elephantiasis. Okay, is suffering with elephantiasis. That is nothing but what? This disease is well known as what? Elephantiasis. Or otherwise, now with all this we can simply conclude that that particular individual is suffering with what? Filariasis, commonly called as filariasis, well known as what? Elephantiasis. So with all this we can say that he or she is suffering with elephantiasis. Now, what could be the treatment? What could be the treatment that can be given for this particular individual? Okay, so what is the treatment? We are going to just see in two words. What is the treatment? Here we have to remember in the very beginning, please note that there is no complete cure for this disease called as filariasis. Okay, please remember I am using the word filariasis and also elephantiasis, which means the same. Okay, commonly known as filariasis, it is well known as elephantiasis. Okay, well known as elephantiasis. And the very important point that we have to remember is that there is no complete cure for this particular disease. Only thing is that we can control. Okay, we can control the spreading of this disease. Okay, spreading of this disease, but we cannot completely cure this disease, they say. Is it clear? So we have to keep that point in mind. So there is no complete cure, only we can control it and prevent it. That we are calling as what? Prophylaxis. Okay, prophylaxis. Prevention is better than cure, we say. So here, in order general treatment, for general treatment for this disease, they will be using albendazole. Okay, albendazole with diethyl carbamazine. Okay, diethyl carbamazine. Okay, albendazole with diethyl carbamazine. In short, it is called as DEC hetrazine. DEC hetrazine is the treatment or the medicine that is given for controlling or treating this particular disease called as filariasis. And remember that there is no vaccine. Okay, there is no vaccine for this particular disease. Okay, there is no vaccine for this particular disease, they say. Okay, so here we have to remember that we can control this disease, but we cannot completely cure this disease if a particular person is suffering with this disease. So in this we have learned that about the filariasis pathogenicity and treatment. Okay, treatment. So in treatment you have to remember albendazole, which is given with what? Diethyl carbamazine. In short it is called as DEC heterazine. Okay, DEC heterazine. So these are the points that we have to keep in mind when we are discussing about the filariasis pathogenicity and treatment. Filariasis pathogenicity and treatment. Filariasis, again I am using another word or well known that this disease, okay, filariasis is well known as what? Elephantiasis. So in the next video we will meet with another disease that is infecting the human beings. So in conclusion, let us remember that the treatment, okay, albendazole with diethyl carbamazine, DEC heterazine, commonly called as. And remember that there is no vaccine for this disease. There is no vaccine for this particular disease known as what? Filariasis. Okay, filariasis. Thank you so much.